as always, just like to begin today by acknowledging the traditional custodians of the land on where I live, which is the Gadigal people of the Eora Nation, and pay my respects to elders past, present and emerging, and extend that respect to Aboriginal and Torres Strait Islander people online today. So my name's David Burns. I'm the Western Sydney Moving Lead, and I also run a social enterprise called Collective Leisure. And today what we've got is we've got two fantastic guest speakers, which I'm really excited to give them the opportunity in a second. But yeah, before we start, really just want to set the context again of why we're here. So Western Sydney Moving is a whole of system initiative to reduce inactivity and inequalities in Western Sydney. So we're a group on this call of practitioners and researchers and academics, and we're all working together to enable more active lives through movement, physical activity and sport. So with the guest speakers, we've got Simon Rosenbaum, who's an associate professor, very well known in the field of mental health and physical activity, and he's going to share the work that they're doing over at ADDI Moves, which is around trauma-informed health promotion programs for people who may have experienced some form of marginalisation. So I'll be handing over to Simon in a second. But then we've got Sarah Driscoll as well, who's from the Diabetes Prevention program, and she's the manager there, who's going to be talking about their 10th anniversary 2K challenge that they're doing, and also yeah, a few other bits and bobs. But a bit of an update from me just to where we're at with Western Sydney Moving. So we've been incorporated now as a company, which is really exciting. So we're registered with ASIC, which is the Australian Securities and Investment Commission, and we're waiting on our charity status. So that should be with us within the next 30 days. But they've acknowledged our application, which is great. We've got our first board meeting as an organisation on the 9th of September, and then we'll be issuing comms in terms of who those board members are, and a little bit more about where we're at with the charity. At that first board meeting, we'll be going through simple things like who's going to be the chair, treasurer, but one of the first things we'll be talking about is the Western Sydney Moving Symposium, which is on the 21st of November, where we'll be officially launching the charity along with the board, and also releasing a white paper which we're co-authoring with the Centre for Western Sydney, which is part of Western Sydney University. And the symposium is going to the white paper is going to underpin the symposium. So we're going to have some recommendations from the white paper, which will be conveyed at the symposium. And all the delegates will get the white paper 2 weeks before the symposium, because, like I said, a lot of the event there will be talking about that white paper. So that's very exciting. And within that document, we're going to be looking at the cost of inactivity within Western Sydney. So that is for the chief economist at Western Sydney Uni, who's pulling that together for us. So there's early bird tickets left. So please feel free to purchase them. We'd love you to be there. It's only $100. That covers your food, and we'll teas and coffee, and you'll get a gift bag. So that's on the 21st of November. So enough about me, but I'd love to hand over the reins to Simon, and who's going to share some of the terrific work at ADDI Moves.
Brilliant. All right. David, thanks so much for the opportunity to present today, and also just a big congratulations to you. You know, it's amazing what you've been able to build, and to bring a group like this together. It's just not the norm, unfortunately, with academic work. So it's great to us to get out of our bubble and have an opportunity to just trying to mute these notifications. Sorry. Okay. Yeah, so thanks so much, David. It's really exciting to watch what you're able to create. I'd also like to acknowledge that I'm here at UNSW on the lands of the Bidjigal people and pay my respect to elders past and present. I'd also really like to acknowledge our wonderful team, and this is a newly launched group that we're about to publicise called Nexus, or Nutrition, Exercise and Social Equity, and we're a research group within the discipline of psychiatry and mental health here at UNSW. And just acknowledge some of our other collaborators, particularly Dr. Oscar Lederman from UTS, Mind Gardens Neuroscience Network, who have been incredibly supportive. And also our wonderful team that this work, I'm lucky that I'll be talking today, but actually there's people online who would do a far better job. Dr. Grace McEwen, Chiara Mastrogiovanni, one of our PhD candidates and EPs, who's actually the heart of what I'm going to talk about today in terms of providing the services, as well as Uzma Chowdhury. So what are we going to talk about today? Essentially, there we go. We talk about the universal right to health. And when we talk about health promotion and physical activity, the work that we do is thinking about how do we support people who typically are excluded from health promotion programs or who typically don't have access for a number of reasons. Part of this has been the way we've often considered interventions like physical activity or exercise, that this is a bonus, or it's it's great if we've got time and if we address basic needs first and if we address mental health status and if we address all these other things. But actually what we're seeing, what the evidence tells us, is that we can use things like physical activity as a strategy to not only improve mental and physical health outcomes in these groups, but also as a funnel, as an alternative route into traditional mental health care and also into other social services. So the groups that we're particularly interested in here, people living with mental illness, people from a refugee or asylum seeker background, people experiencing homelessness, gender-based violence, food insecurity, financial hardship, culturally, linguistically diverse communities, people living with some form of disability. And really, when we think about all of these things together, it's rare that someone fits into one of these categories. It's actually this idea of intersectional disadvantage, where it's highly likely that people will fit across not only one of these, but multiple of these categories. And so the basis of the work that I'm going to talk about is how do we support people that might fit or identify with one or more of these categories into a supported physical activity program that can meet their needs. So this is where we start with the Addison Road Community Organisation. So for those that don't know, Addie Road is based in Marrickville. It's an incredible not-for-profit charitable organisation. The primary thing that Addie Road do is help people get access to food and groceries. So they have a food pantry. You can see that picture on the right. They feed about 8,000 people a week, which is just incredible. And the demand for food services and for groceries is just increasing. And this particularly exploded since COVID. So it's a great site. It's an enormous site. Some people might be familiar with the markets that are on the weekends. On site, there's around 40 social services. So it includes the food pantry, but it also includes the Marrickville Legal Centre, includes GBV charities, there's art spaces, there's a whole bunch of psychosocial based interventions. Once a week on a Wednesday night, there's also street-side medics. They're GPs who come and provide free medical services. And people do access Addie Road from all over Sydney. It's not just people in Marrickville. And that just shows the demand for those services. So 24th of January 2022, this is what a little hut inside Addie Road looked like. And this is when Dr. Grace McEwen and I first got the key. Now, when we initially spoke to the CEO, Rosanna Barbero, who's an incredibly inspiring woman, and if you Google Rosanna, you'll find a story in the Washington Post where she single-handedly brought down a Gates Foundation trial that was supposed to be done in Cambodia with prostitutes, where they were testing a new drug, and Rosanna managed to mobilize the prostitutes to say, go test your drugs somewhere else. And it was, she's an incredible force and a really inspiring person to be able to work with. When we sort of pitched the idea to Rosanna, she said, sure, you can set up a gym, that's fine, but over my dead body, will you get me in there? And so part of what we did, and this was work, again, that had been led by Dr. Oscar Lederman at South East Sydney Local Health District, was saying, okay, if we're going to introduce this sort of service, we actually need to start with the staff first. We need to ensure that we can support the staff like Rosanna to understand exactly what it is that we're doing. And so it's precisely what we did based on a project called Keeping Our Staff in Mind, which we'd run previously. We provided access to the exact program that we wanted to provide clients, but to the staff around Addy Road and the services. And just an example of how effective that was is Rosanna standing up at 1 o'clock, leaving meetings no matter who she's with and saying, right, this is my gym time, I'm out of here. So that was a really important aspect of what we were trying to do, is to just bring everyone along to actually show them exactly what it is that we were trying to achieve. Fast forward to 2024, that's what the space looks like now. So it's very, very different. This is a fully functional exercise physiology clinic. We have students, we have individual classes, we have group sessions, again, run by the wonderful practitioners, Chiara and Uzma. A couple of things, and there's lots of little touches here that again, Chiara would be better placed to discuss, but that mural on the background was painted by 3 refugees. And that was done as part of the idea of the space being their own, and really thinking about aspects of that space. How do we create an environment, a physical activity environment that is safe, that is welcoming, and that is appropriate to the needs of the people that we're trying to reach? And only a few weeks ago, we had another open day, which was great. And you can see, a couple of little touches, but in the back, you can see that map on the wall. And this was a great touch. This was an idea from Refugee Health, one of our partners, about having a map with a corkboard so people can put a little pin where they come from. And that's a great way of starting conversation. It's been a really useful part of what we're trying to do. I'm not going to talk much about the data, except to mention that if we think about the people that we're reaching, again, people experiencing very significant social inequality, disadvantage, and to have a rebook rate of over 90%, including for people that are experiencing homelessness, to me is quite incredible. And again, all credit to Chiara and Uzma and the students for achieving that. But I think this, in one way, challenges the notion idea that we spoke about at the start, that, well, exercise is fine, but we have to deal with other things first. And I think that's actually not the case. We can start thinking about these services as an integrated and a core component of other broader social and health-based services. Now, with universities, it can be tricky with this sort of stuff, and it by all means hasn't been totally easy with UNSW, and it's understandable. One of the issues is around risk, which is completely understandable. One of the ways that we've been able to work with UNSW and to try to navigate that is through creating a student placement opportunity. And we've now provided nearly 1,000 hours of student placements to exercise physiologists who are now exposed, or having that experience of being exposed to groups that they would otherwise have never had the opportunity to meet. So again, we're talking people like people from a refugee background, or people experiencing homelessness, financial disadvantage. 2 quotes that again, to me, are very powerful. 1 hour at Addy Moves is worth 3 hours at other placements. This is one of our recent students. And another student, I'm very grateful for the exposure, which has been different to my past 4 placements. Mental health is now what I want to do. So really a key part of what we're trying to do here, we think about 3 pillars. One is research. We want to be contributing knowledge and generating new research. 2 is around service. We want to be providing something useful to the community. But 3 is around workforce capacity and education and training. And how do we bring the physical activity, allied health workforces, as well as the mental health workforces closer together, and what needs to be done on each side of that coin. Now, these numbers didn't just magically happen. We didn't just get a room, set up have a nice painting and get some students. There was actually a hell of a lot of work that went into understanding the little things and what we actually need to do to create Addy Moves and what we wanted, and to realise that vision. And I've got to, again, mention Dr. Grace McEwen here, who led this work, which was a fantastic piece of co-design that has been published, and there's a bunch of resources that I'll provide a link to next. But essentially the process that Grace went through here over 12 months was interviewing not only service users, and these were people from a refugee background, but also service providers. And that was done through recorded interviews. You can see that screenshot on the top right from Farhat, who fled the Taliban and arrived in Australia a few years ago. So there's interviews, there's bits of interviews. Grace then analysed those transcripts and edited those videos together to create a bit of a short movie, then got everyone back together and replayed that movie to everyone together to get another round of feedback to really ensure that we'd captured everything. So a really comprehensive co-design process, focusing on both end users as well as potential referrers. Now that QR code will take you to a link of the paper, and that infographic that you can see summarises the 6 key findings. And I'll mention what they are. And again, although this was done focusing on refugees and asylum seekers, I think these 6 principles are actually can be applied far more broadly beyond just that population group. And essentially, it's not going to be, and to people on this call, it's not going to be news, but it was useful for us to be able to articulate that. And also at our team meetings, we regularly come back to these 6 things to try to brainstorm how can we be doing these better. And we're revisiting these at the moment. So the first one is cultural safety or cultural sensitivity. So how do we create something where culture is welcomed and celebrated? Emotional safety, so a similar aspect, but where people can feel understood, they feel supported. Accessibility is absolutely critical. So this is entirely free. It always will be. We're not interested in changing that because cost is a huge barrier. Even some community gyms that might offer a subsidised service for people on a very low income who are food insecure, that's just not possible to pay those fees. Another example of accessibility is we've got a great charity partner called Thread Together who provide us with free clothing, free exercise clothing that we can hand out to people and give them to keep. And it's brand new, really good quality clothes. That links with the next one, support to address basic needs. So if we think about, and we know from the evidence around physical activity being this destigmatized intervention, people are often likely to share things are likely to come up, and it might be a space where they're willing to share things that might be happening or issues they're having that otherwise they're not sharing. And so ensuring that our practitioners and our staff are understanding, are well connected with local resources so they can actually tie people in and refer people on to address those basic needs is critical. Physical activity literacy, this is a really important one. Not everyone has the same understanding, whether it's cultural, whether it's of the sort of health literacy around the role of physical activity. And if someone feels that, well, let's say they're a carer or they don't have time, taking half an hour to do something for them might be selfish, it might be perceived that way. So ensuring that we actually work with people, with communities around the benefits, not just about preventing ill health, but also about gaining, what's to be gained and the potential benefits as well. So the literacy piece is really important, and we're still unpacking that as we go. And finally, the social and community connection. Again, everyone on this call won't be news too, but how do we use these opportunities for social interaction, potentially social cohesion in among certain communities as well. So that QR code will take you to the actual paper, and again, that paper is summarised in that infographic. For those that are interested, it was also recently covered on a podcast run by the Olympic Refuge Foundation, called Think Sport, Think Refuge, and there's 4 or 5 episodes around physical activity and refugee issues. Additional resources. So Grace also made another video. It's a 5-minute video on the bottom left there, and that QR code will take you to this YouTube channel. That video is Grace explaining those 6 key themes in a bit more detail and better than I can, summarising those videos. And there's also some snippets of the actual interviews that were done for those that are interested. Another key factor is around accessibility, and language is so critical to that. So here we've got Arabic, our Farsi, and also our Ukrainian translation of our referral forms. We've got about 11 languages, I think, where we have material translated in, and this has been a wonderful partnership with Ethnic Services Cooperative, who are also based at Addy Road. They're an NDIS provider, but they have language capability in over 50 languages. So it's been wonderful to be able to work alongside them to leverage their connections with communities to be able to then get people through and provide more of the physical activity program. Some of our partners and people that we're working alongside, so one is STARTS, the Service for the Treatment and Rehabilitation of Trauma and Torture Survivors, and they've been wonderful at sharing resources, supporting our team to build capacity around working with people from a refugee background, and likewise we're supporting them and their staff around how physical activity can be better utilised. They've got a great program already led by David, who runs their physical activity referral program. So we're working closely with David and the staff to try to increase capacity and capability around physical activity within STARTS. Kiara's also recently run a program with women from Afghanistan, again co-delivered, which has been fantastic. The New South Wales Refugee Health Service has also been incredibly supportive. Stepping Out is a charity that provides services to survivors of childhood sexual assault. And they again have been wonderful at supporting us to build capacity in that area, and likewise and the other side about how we can help them understand and think about what the role of these sorts of programs are. So it really is a team effort. We bring something to the table which is around the physical activity, but then obviously these organisations have the expertise, the knowledge, the links with the community that are absolutely critical. Marrickville Legal Centre, and there's a really interesting project being led by Grace, Kemi, and also an honours student, Emma Suzuki, looking at the Work Development Order Scheme, which is essentially a scheme whereby people who meet criteria, so it could be people, for example, from a refugee background experiencing mental illness, who are issued fines, can pay off the fines by attending a health service. Now, at the moment, that's very limited to sort of social work or psychology, I think it is. There hasn't been, no one has tested a physical activity program in that way. Emma's Honours has done the groundwork, about 20 interviews so far to understand the potential of that as an impact. And then hopefully next year that work will continue with an actual trial to see whether people are interested, want to and can feasibly pay off fines by attending an exercise program. I mentioned Ethnic Community Services. There's been a slight name change there. It's no longer a cooperative. It's now Ethnic Community Services Limited, but they've been absolutely wonderful at providing that links with community and language. And that final logo is the Burmese Rohingya Association of Australia. And again, Grace led some fantastic work with that community, looking at food security, physical activity, and the relationship there. Where this leaves us now, and the next step for us is, can we get an Addy Moves mobile that can drive around and service these different partners with students, building capacity, trying to understand, generating new knowledge about not only how do we work with these groups, but also leveraging their expertise and skills in these very specific cohorts. So that's what we're working on in the future. And then the next step is around how do we better utilise the food pantry, and which is about 20 metres away from Addy Moves. So if anyone is interested in coming, you're all welcome to come and visit us there. But how do we potentially have dietitians supporting people at the food pantry, helping with recipes, all those sorts of things. And that's Dr. Scott Teasdale here at UNSW, who does a lot of work around one of the leading dietitians in mental health research and practice. So it's great to have Scott involved there. You know, finally, my last slide about the vision for us, what we think about our allied health graduates. It's not just EPs, but also in the future physios, dietitians. But how do we create allied health graduates that are culturally sensitive, mental health and trauma informed, socially conscious, and really plugged into a global movement? And for those that saw the Olympics a few weeks ago, Cindy Ngamba won the first medal for the Olympic refugee team. So this year there were 37 athletes competing in Paris under the refugee banner. So there is this broader, social movement happening, and it's great for, I think, the opportunity that we're trying to build for not just us, but other allied health graduates. And again, I think just a shout out to the UTS team, who are doing a really fantastic job of doing this as well. Again, just acknowledge the entire team. So Scott, Grace, Kemi, Oscar, Dr. Shobuj Mystery from Population Health, Carla, Miranda. We wouldn't be doing anything without Carla, who manages all of our finance and administration. Kiara, Uzma, our wonderful practitioners. Afsana and Dina, PhD students from Bangladesh and Indonesia, and also Ollie, wonderful research assistant working with us. David, thanks so much. Thanks for having me, and hope to see everyone at Marrickville sometime.
Wow, thank you, Simon. So inspiring, and yeah, it's quite unbelievable what you're achieving over there, and the potential as well. I think it's really world leading in this space. But I'd like to open it up to the group really, to see if anybody has any questions, observations. Just put your hand up, and we'll go from there. Simon, I might just jump in first. If there was one ask of the group, the network, you've got a heap of people here from obviously different parts of the system. How could we help Addy Moves?
Good question. So a couple of things. I think Addison Road Community Organisation is obviously unique. It's an incredibly unique spot, and our ability to engage community, to get referrals, is leveraging their decades-long presence within the community and the trust that they have. Now, obviously, that's not replicable in every area, and we're very conscious of that. So we're very conscious of trying to understand what are the bits that we can develop, the knowledge that we can generate that is replicable, that can be used. And I think there are principles around that. So in terms of the ask, I mean, I guess it's just recognizing that people in different communities, working in different places, there's going to be those contextual factors, I guess, that are really important. And I think it's through those that we actually learn from each other, and that we can then take what some of those key learnings that can be applied. So I'm sort of rambling there a little bit, but I guess the interest for me is thinking about everyone here in their unique setting. What are those factors or those key learnings that can be transferred and that can be shared? And that's the bit that I'm most interested in trying to understand. So having people visit, please get in touch with me, Grace, Kiara, Uzma, and sharing those things. Any ideas, we're very welcome to, very open. This is by no means, this is one model, I guess, is what I'm trying to say. It's just one example.
Yeah. No, thank you for that. And I'd encourage anybody to just go get a feeling of the place and start some conversations, because you just never know where it's going to go. Brent, over to you.
Hi there. My name's Brent. Happy, what day is it? Thursday. Happy Thursday, everyone. I better introduce myself. Hi, I work for Exercise Sports Science Australia. Simon, you may have heard of us. I would be very interested in talking further with you and the team about some of the stuff you're doing, and if there's anything we can do to support. But I'm also wearing a second hat as someone who works in developing community physical activity pathways and connections to allied health. And I was wondering if you and the team would be interested in talking further about if there's a way that this service can support people in connecting to your service, or even finding allied health streams to deliver this appropriate level of care. There's a lot of nuance to it, and I think I'd like to discuss further. Just wondering if you would, based on that brief summary.
Definitely, Brent. Absolutely. I think allied health I don't think traditionally allied health has been good at thinking about. No, that's not fair. I don't think allied health. I don't think we've done well at reaching disadvantaged communities, really. And I think part of that, if you think about sole practitioners, and it's totally understandable. I mean, there is no way that we could be doing this if it was a private clinic, because you just couldn't make money. So I completely understand those barriers, but I think this is where, and I guess the people on this call, but interested in what's the responsibility of other sectors to actually generate, support and resource those initiatives. So Brent, absolutely, really happy.
Perfect. All of this is predicated on a preemptive local context assessment that then identifies workforce gaps in the area that we can then work to address. So
definitely,
I've probably got your email. I'm keen to reach
get in touch. I mean, the only other thing is just around volunteer. I mean, I've been amazed at how many contacts we get from practitioners, physios, EPs that are like, hey, I want to volunteer an hour or so a week. And I think that's a really exciting potential opportunity as well.
Perfect.
Thanks, Brent. That's great. And we're going to go to Dana from Camden, then we'll go to Scott from West Prime Health Network, and then we'll go to Sean from Raw Life. But over to you, Dana.
Hi, Simon. I just wanted to say thank you so much for your presentation. I really learned a lot. So I'm the manager of Sport and Rec at Camden Council. We're the fastest growing LGA in all of Australia. So we have a lot of growth, lots of new communities. And when I looked at your presentation and started thinking about it, what we do in local government in the sport and rec sphere sometimes feels like a million miles away from where you are. So I want to understand how we can bridge that gap. And, you know, are there barriers that we could address simply to try and come closer to what you're doing and all of your amazing work? Because it feels we're at quite different ends of the spectrum. And so how do we move closer together so that we can leverage off your research and understanding what the barriers are, and I can put into place you know, things to start breaking down those barriers simply, incrementally, over time, consistently, and move so we can move closer together? Because I feel like it feels like we're far apart, but we shouldn't be, if that makes any sense.
Yeah, no, thanks, Dana. Lovely to meet you. And absolutely, please get in touch. I think there's a huge, one of the things that we've probably done is, I guess we've got a bit of a roadmap around how a partnership between community centre, a local university, and leveraging the student placements actually can meet everyone's needs. So yeah, very happy to share how that's worked. So please get in touch.
Thanks, guys. And I will just pause there a second, because Simon was one of the guest speakers at the first symposium, and actually Dana's going to be one of the guest speakers at the new symposium in September. And you know, at that event, we're going to try and bring the system together to talk about this stuff, how we can start connecting a little bit more in person. So, you know, just really encourage people, if they can, to make that event. Over to you, Scott.
Thanks, David, and thanks, Simon. I'm sorry I joined a little bit late, but very much appreciated your presentation. Intro myself, I'm from the Western Sydney Primary Health Network. So we worked with PHNs before, but we work with commissioning providers in the region to fill gaps, and work with our primary care providers, GPs, aged care homes, allied health and otherwise, to improve capacity and capability and transform the system to bring it together more, exactly to the stuff that David's spoken to. I appreciate so much the nuance of the area of Addy Road, and I lived in Marrickville and around the area as well before. And I can see how it has developed based on those relationships over years and decades. I'm intrigued, I suppose, to chat with you how that could be extended or extrapolated to other regions. And particularly when I'm looking at, we look after the Western Sydney region. We've recently in this year developed very much a place-based approach around local government areas, and we're focusing on the Cumberland region in the first instance, which is equally a very diverse community, supporting, you know, people from multiple backgrounds speaking multiple languages. We also commission services such as STARTS that you mentioned in your presentation as well. So I guess in the first instance, I see a lot of synergies in how we could do this in a not the same way, but another nuanced way, leveraging on the work that you've done, particularly in the Cumberland region. And we formed the Cumberland Healthcare Neighbourhood this year that brings together providers that are not just health background, but social, counsel and otherwise. And I'd love to seek your input and thoughts on how we could do a similar thing, or begin to look at something like this, leveraging the work that we already do in Western Sydney. So I'd love to pick this up a little bit later.
No, sounds great, Scott. You know, really happy to chat. There's definitely been some learnings from us about navigating the partnership, you know, meeting the needs of all those different stakeholders. I think the biggest thing I just say, and I know we're running out of time, but it's just about, for me, it's about how do we put these services where people are instead of the other way around. And I think I've typically got it wrong.
I agree. Thanks, Simon. We'll chat soon.
Great, guys. Thank you. Over to Sean Jackson.
Thanks, David, and thank you, Simon. Hi, everyone. Hi, Simon. So, Sean Jackson from Royal Life Saving Australia, the national office. We're based in Broadway, Sydney. I guess we bring people together, an industry together around drowning prevention and enjoying the water safely. So, just hearing your presentation and looking at your website around mental health and exercise, and knowing the benefits of accessing the water for mental health in particular, I just wanted to flag, it was more a comment really, just flag, I wonder if you've reached out to any local aquatic facilities or the like, and we know that the aquatic industry is not an easy place to enter. Aquatic facilities are often quite challenging for people from diverse backgrounds. So it's something that like we're trying to improve. And so I was just kind of joining the dots and thinking, wanted to flag, have you reached out to local aquatic facilities? Could we help you to do that? Perhaps there's programs around that, because it is something we're trying to, that's why I'm here, I guess, at this meeting, trying to kind of join the dots there. And obviously it may not be for all participants in the program, but if they have a connection to water and swimming, and they feel they don't know how to approach that part of exercise in Australia, then maybe there's something in there. So just a comment, really.
The short answer is no, we haven't. The second is that would be great. It's a big gap. If we can funnel people services like that, that would be great. There's a local aquatic centre around the corner from where we are. So yeah, we'd love to. If you know if there is something we can build there, we'd love to.
Yeah. Well, I can certainly play a role in kind of facilitating a connection or helping out or anything like that. So perhaps we could connect after this. And yeah, thank you.
Sounds great. Thanks so much, Sean.
Thank you.
Thanks, Sean. And we'll just go to our last question from Karen from the Western Sydney Local Health District, and then we'll hand over to Sarah Driscoll for the second presentation. Over to you, Karen.
Thanks, David. Thanks for a very interesting presentation, Simon. I work at Western Sydney Local Health District, like David said, in the Healthy Places team. So I'm within the health promotion team, and we focus, we focus on healthy built environments, and we have a formal partnership with Cumberland Council. So I was really pleased to hear what you had to say, Scott, because I wasn't aware of the PHN's work specifically with Cumberland. So yeah, I guess I'll just be keen to know more about that work, and if I can support that in any way, I'm very happy to. Thank you.
Thanks so much, Karen.
I'll be providing Simon's contact details with the minutes, which we'll send out in the next week. So please feel free to connect with Simon. So again, Simon, thank you, and please extend those thanks to the whole team, because obviously, like you said, there's a lot of people behind the work that you do there. So I appreciate your time today. Okay, so Sarah, are you there?
Yes, I am.
Fantastic. Okay. Yeah, over to you, Sarah.
Pardon me. Thank you, David. Simon, that was wonderful. Such a small world. I actually have listened to a lecture of yours previously when I was doing my MPH. It was on trauma. It was fabulous. And I also went to uni with Scott. So a very, very small world. So hello, everybody. So I'm very new to this role. I've stepped into Janine's shoes. So I'm the Diabetes Prevention Manager here at Western Sydney Diabetes. Before I launch into a few of my topics for today, I just wanted to begin by acknowledging the traditional custodians of the land and pay my respect to their elders past and present. And I extend that respect to any Aboriginal and Torres Strait Islander peoples on the calls today. So a little bit about me. I've worked in the public sector for over a decade across various capacities in clinical, community, research and education. I have a background in food science, dietetics and very recently public health. And I've lived in Western Sydney for my whole life. So I think I have a very good understanding of the health landscape in the region. So very excited to use my knowledge and lived experience to drive community health initiatives across Western Sydney. So very recently, Western Sydney Diabetes, we had our 10th anniversary celebration. Was there anyone on the call in attendance? Maybe just raise your hand. I was invited as a guest. Yes, I've got Scott. I hadn't officially started in any capacity with WAF. Few of you, wonderful. But it was good. It was a very good orientation for me. It was a fantastic night. So we were joined by over 200 doctors, nurses, community leaders, and politicians from Western Sydney, really to just celebrate what Western Sydney Diabetes and our alliance have achieved over the last decade, and then looking ahead of into the future. We had 5 panels that were facilitated by Dr. Norman Swan from ABC and a local leader, Dr. Jim Taggart. And it was wonderful. So our panels consisted of a panel of the pioneers of Western Sydney diabetes, primary prevention champions, general practitioner champions. We had some government perspectives, and then looking to the future of Western Sydney diabetes. So as I said, it was a really good night. We had lots of trade shows to begin with, and then these panels. And I think what really stood out on the night was really just the power of the alliance. We have an alliance of Western Sydney at Western Sydney Diabetes with over 140 partners and organisations. And, really by working together, we really are making progress in the fight against diabetes. And the event really has acted as a fantastic springboard with a lot of interest and follow-up, particularly from local and state government, which is really exciting. And I think something that I did want to flag today, a very tangible example of those collaborations is the launch of our 2 kg challenge, which I've asked David to bring up in a minute. So some of you may have, particularly if you work in Western Sydney, you may have heard of this. We have been promoting it a lot on socials. So it's an initiative by Western Sydney Changing Diabetes between us, Western Sydney Diabetes, the Workers' Lifestyle Group, and the pharmaceutical group Novo Nordisk. It kicked off in July, so it's very early. It's about awareness, detection, and prevention of diabetes by providing our community with exclusive and free access to events and educational resources all in one place. The idea is really, really simple. It's just to lose 2 kilos. It's evidence-based, so we know that by losing 2 kilos, people at risk of type 2 diabetes can lower their risk by 30%. And with my background in dietetics, I've worked in the obesity space for many years, and 2 kilos is a really achievable measure for people. I know that even by, setting goals of 5 kilos could be really overwhelming for people. So that 2 kilos, as I said, it's evidence-based, but it is really small and bite-sized. So we're really hoping that it reaches as much of our community as possible. So, David, do you have the website up there?
Yeah, I think I just shared it. Did everybody see it?
Oh, perfect.
Yeah, I just shared it, but I can share it again.
Oh, that's fine.
Yeah.
Wonderful. So this is our website. So we're very much soft launched. So we soft launched in July. It has gone out across various platforms. So Wentworth has facilitated its launch across 27 GPs in our area. It was launched in Blacktown, in the workers at Blacktown with staff and members. And then following that, our anniversary event, both the Hills and Cumberland mayors have expressed interest. So we're having meetings with them as well. So in terms of website content, because it is a soft launch, we're trying to bulk it up, which is why I'm discussing it here today. So in terms of navigating it, if you look into resources, you'll see basically we've got a few little tips and tricks. We're pointing people really to sign up with the Get Healthy service, the New South Wales Get Healthy service, which is fabulous. I've done a lot of work with the Get Healthy service in the past. And for anyone that's not aware of this service, it's a free phone coaching service for people aged over 16 in New South Wales, and they get personalised health coaching with the same coach for up to 6 months. And we're also pointing them in direction of utilising No Money, No Time, which is a fabulous initiative from the University of Newcastle. And again, it's all about that personalisation. So participants go in, they fill out a quiz, and it spits out personalised meal plans and recipes based upon where they could improve. So it's all about really consolidating resources, but trying to make it as personalised as possible, because we know with weight loss, it's not about one size fits all. On that website, you'll see there's a calendar, and we did that because, a lot of gyms and things, when you register for exercise programs, it links to your phone often and it's in your calendar. So with the calendar, we have events for the month. So we are, again, trying to promote that activity in Western Sydney. So we've got, health nudges for trying Park Run or other free exercise programs in our area. We've got links to recipes, line dancing at Workers Blacktown, salsa. So anyone here on the call, if you have anything that you think that would be appropriate for this initiative that could go on the event and the calendar, or even any resources, links to blogs, if you do any healthy eating blogs or anything that you think would be appropriate, please reach out to me and we can talk about how we can bulk it up, because it really is, we're aiming for it to be a real resource hub for people when we start to really hard launch it. So that would be great. So just get into contact with me. And then the final thing that I just wanted to flag, I know that I have someone on the call who is actually a presenter that night. I saw your name. Anyway, you'll be able to put your hand up when you see what I'm talking about. It's the Moving Forward with Type 2 Diabetes program. So this is a great forum that is taking place next Tuesday night here at on the Blacktown Hospital Council in the Western Sydney University building. So essentially it's for the EP, it's for everybody, but it's really targeted towards EPs. So it's a great opportunity to really dive into how exercise and CGM, continuous glucose monitors, can make a difference for people with type 2 diabetes, and how EPs can really better connect with primary care. So the event kicks off at 6:15 next Tuesday with some refreshments, networking, and you'll get a free CGM insertion as well, which will be really fun if you are going to be using this in your practice, because you can see, based on what you eat with those refreshments, how your blood glucose levels either spike or whatnot. So yeah, really about a hands-on look at the technology. And then the program kicks off at 7. So you'll have talks on providing a clinical overview of diabetes and exercise, how CGMs are changing lifestyle interventions, and how EPs can make the most of CGMs. And there'll be a plenary discussion as well. I know I provided David with the flyer. On there it does say registration, I think, closed 2 days ago, but please just ignore that. You can either register or just rock up on the night. We've got a very big space, so we're not too concerned with numbers, but please share amongst your networks, because it's a fabulous forum, and CGMs are a really emerging innovative technology that it's just going to take off more and more. So EPs will be able to really customize their approach with clients. And that's
Brilliant.
it from me.
I was trying to find the link there, Sarah. I can't find it. Sorry. I will.
Oh, that's okay.
Yeah, if you've got it there, maybe just pop it in the chat. That would be really good, and then people can just go straight there to book in. I think it's next week. So, any questions there for Sarah, please? Thank you so much, Sarah, for that. That was really, really great, and welcome to your new role. And glad you're jumping on with this network. I was apology for the 10th anniversary because I was in the UK. So, but Oscar, over to you, Oscar Lederman.
Great presentation, Sarah. Thank you. Oh, hang on, I'll put my camera. Awesome to hear about the work that happens there, and would love to learn more. I'm going to send you a separate email to reach out, because there's some work that actually David and Yvonne, who's on this call, is involved with, a physical activity program to support Pacifica mothers in Western Sydney.
Wonderful.
And then we did some co-design work similar, not to the extent of the work that Simon did with Addy Moves, but it was definitely co-design with 18 mothers, and we put a pilot program together. We just want to continue that good work. So I'd love to talk to you about what synergies could happen there. But a separate question, I'll send you an email, but a separate question is, I guess, about the 2 kilo challenge. A lot of the education and I guess one of the biggest drivers that people come and present to us with is around weight loss. Working in mental health for many years, I've seen how difficult weight loss is, and a lot of the advocacy that comes from what I provide education is around physical activity, improving fitness as risk factors for reducing cardiovascular risk and diabetes, independent of any changes in weight. I'm wondering, like, what is the success that you get from that 2 kilo challenge? And, do people get quite fixated on weight? Also, does it consider things like body composition, and if people are exercising, improving muscle mass might not actually change what the weight, what the scales say?
Yeah, great questions. We've only just launched in July, and we are collecting weight. This is not a research project; it's just it's population level initiative. So when participants sign up, they don't actually have to sign up. So we know that signing up is a barrier for people, and we just want to reach as many people as possible. So we are getting participants signing up, but we are getting a huge amount of traffic and so we're seeing that people are looking at resources without signing up as well. But if they do sign up, they don't actually have to put in weight, because again, that could be a barrier for people signing up at all. They don't want to put in their weight. So we're definitely not collecting body composition. And I guess in terms of outcomes, we will just essentially hopefully see a decreased risk of type 2 diabetes, over a number of years. So we're not collecting those specific measures yet. In terms of, I totally agree with you. In terms of, it is more about small health nudges to encourage changes in lifestyle, so that's why we are really trying to make it a resource hub, so it does become, not a one size fits all. We're not about just giving out generic meal plans. Those things don't work. Generic advice, those things don't work. So that's why we really have partnered with the Get a Healthy service, who do wonderful work with the no money, no time from Newcastle University as well, because again, that customizable meal plans, recipes, lifestyle changes to make it sustainable. And I guess the next phase, something that I will be working on, is all about that weight maintenance, because definitely the hard bit is not actually losing weight. Anybody can lose weight. It's keeping it off. That's the challenging part, because we're going back into our environment that encourages us to gain weight. So that will be a really big part of the next kind of phase of it, will be about weight maintenance.
Thank you.
Thank you. But please connect. Thank you.
Yeah, we'll do. Thank you.
Thanks, Oscar. Thanks, Sarah. Laurie, did you have your hand up there? No?
It's an accident, sorry.
Oh, no problem, no problem. Thanks a lot, Sarah. Really appreciate that. And yeah, like I said, welcome to the group, and hopefully see you next week. Now we've just got an opportunity for the last 5 minutes. If anybody's got anything to share, what's on your mind? Is there anything we can help you with at the moment? So please feel free to, Laurie, over to you. Or is it a mistake?
Now I'll put my hand up.
All right.
Thanks, David, and so great to see you, Sarah. Welcome aboard. Really great to have you. Just a quick plug, mountain bike symposium for anyone that's really into the mountain bike space, which is a great active recreation activity. We have a symposium in October in Merimbula, so I'll put the link in the chat for anyone that's really interested. But this is a really important symposium to bring all the issues and opportunities that are associated with mountain biking into one space. So hopefully we'll see you down on the far south coast. Thanks, Dave.
Thank you. Appreciate that. Anybody else? Yes. Shana?
Janae, close one.
Janae,
It's a very hard one
sorry.
to pronounce.
How good to see you.
Yeah, it's good to see you too. It's actually my first attendance on here, and it's so great to see everybody like coming together and connecting as a whole, because I feel like it really just helps with the, I guess, with the community. Obviously, the goal of everyone here is, I'm assuming, to reach, I guess, the community on a greater scale, and coming together, I believe, truly helps that. So it's so good to see. And I was just going to say, Sarah, that I do have some resources that could potentially help. So I'm happy to potentially connect after this as well. Amazing.
Thank you. You're very welcome. And over to you, Sean.
Thanks.
Thanks, David. Just very quickly, I'm involved in a project through Human Ability, which is the Jobs and Skills Council for the sport and recreation industries, where we're looking at active volunteering and I guess what's required to be a volunteer, and how training volunteers could be more practical and pragmatic, and less of a, I guess, less burdensome in terms of creating a roadblock to volunteering, because we all know that, volunteering is facing more and more challenges, and what a critical role they play in our industry. So I just wanted to flag that if anyone had wanted to reach out to me and have a conversation or share any inputs on what they think the skill set or the challenges are around volunteering. I'd be interested to hear. And second thing is just a quick plug. We launched our annual National Drowning Report yesterday down in Canberra. I think 333 people drowned in the last 12 months, which is about a 10-15% increase on the kind of 10-year average. So if you see any media around that or any kind of anything, yes, please kind of like and flag and promote the importance of raising awareness around drowning. Thank you.
Right, thanks. And we've just got 1 minute left, so I do want to finish on time to respect everybody. But just 30 seconds maybe over to Fiona Campbell and then Heather. So over to you, Fiona.
30 seconds. My name's Fiona. I am planning to run a pilot evaluation of subsidised e-bike hire for communities in Parramatta area that are transport disadvantaged and struggling with cost of living and so on, to help access to jobs and services. So I'm working with Parramatta Council, getting some help from Western Sydney Local Health District and Sydney Uni to evaluate it. The greater purpose is to then provide the evidence to convince state and federal governments to invest large scale into helping people with mobility by subsidising e-bikes. If you want to know more, just get in contact. Thank you.
That's terrific, Fiona. Thank you. And just over to Heather to finish us off.
Just very quickly, hope to see everybody tomorrow, or lots of people tomorrow at the Future Health Forum, Greater Western Sydney. I think you're speaking, David, aren't you? Which is great, and it's sponsored by all the different LHDs and PHNs in the region. So a really important forum, particularly because we've got ministers coming and people like that. So hopefully I might catch some people tomorrow, but it's a really important forum for Greater Western Sydney.
Beautiful. Thanks, Heather. And appreciate everybody giving up your time today. I know you're all busy, but you know, it's just such a joy to have so many people involved in this, and really excited about you know, where we're going. So take care. Hope to see you all soon, and yeah, we'll send out the minutes and the recording in the next week or so. Thanks to our guest speakers again. See you all soon.
Thanks, David.
Thanks, David.
everyone.
Bye.
See ya.
Thanks,
Bye.
David.